Good evening, everybody. Thank you. Welcome to a Compass to Care MS program. All right, this is an event. This is a series of programs created by MS Views and News. We are the only ones in the country that have the label Compass to Care, and we're doing these types of events, again, in different portions of the country, simply because we are providing things that concern the other aspects of multiple sclerosis. It's not always about the drugs that you see at many programs, but there are many other things that are going on as well. So like tonight, in addition to Dr. Hemphill, we have Dr. Gretchen Hawley, who's a physical therapist, and she'll be speaking to you about things to do with physical therapy. All right? Moving along quickly now. This program tonight, I want you all to know that we're being supported by Sanofi, Genzyme, and Celgene. If you don't know Celgene, you'll be hearing more about them in the coming months. Sanofi, Genzyme, you do know about. And again, they are the supporters of tonight's program. Tonight's event, as I said before, Dr. Gretchen Hawley is here. She'll be speaking for 35 minutes. And then we're going to do a 20-minute Q&A. Following Dr. Hawley, following her Q&A, Dr. Hemphill will speak for approximately 45 minutes, and then we'll do a 30-minute Q&A with him. All right. Dr. Gretchen Hawley is a doctor of physical therapy, multiple sclerosis certified specialist, partner in MS Care through the National MS Society. She is a doctor of physical therapy and multiple sclerosis certified specialist. After graduating from Simmons University in Boston, Massachusetts, she developed a multiple sclerosis program alongside two of the city's top MS neurologists, optimizing mobility for each of her patients by using specific functional exercises geared towards the patient's current abilities and goals. Dr. Hawley utilizes the concept of neuroplasticity to improve strength, balance, and walking. Let's let Gretchen explain all the rest to you. Come on up. Thank you. And welcome.
Thank you. Hello, everyone. So I'm super passionate about talking to groups like this because personally I find that a lot of clients come to me saying that they don't even know why they're coming to physical therapy because they have a progressive disease and they don't think it's going to work. Or they did have physical therapy before and it didn't work for them. So I want to tell you guys exactly what you can do, even things you can take home today that can start helping you towards your goals, and telling you also why maybe it didn't work for you in the past. So we're going to be covering a lot of different topics today, starting with the benefits of physical therapy, neuroplasticity, which is a hot topic. Hopefully you guys have heard of it. If you don't, I will explain it. Exercise guidelines, and I'm going to give you two of my favorite exercises that I think everyone with multiple sclerosis should be doing, no matter if you are mostly in a wheelchair or if you're running marathons. Everyone should be doing these two exercises. We're also going to talk about getting on track with physical therapy and virtual physical therapy, specifically for multiple sclerosis. So before we jump into all of that, you might be thinking that's a lot to learn in 35 minutes, and it is. But also because it's the end of the day and it's a Monday, what I want to spend just 1 minute doing right now is a moment of being mindful. The reason for this is our brains are constantly going all day long. And the limbic system is part of our brain that is constantly in fight or flight mode. So if it's constantly trying to keep us alive with questions like, am I overheating? Am I thirsty? Am I hungry? Am I too cold? What am I feeling right now? What do I need to do to make sure I'm staying alive? Then it's impossible to learn all of the amazing information you're going to learn tonight. Not only that, but it's going to be very difficult to recall it later on. And it's also much more challenging to calm your brain down and gain control over your symptoms and your mobility and just your general well-being if that limbic system is constantly going. So we're going to do a very quick exercise, and the main reason I want to teach it to you is because this is something easily that you can do at home daily if you need to regain that control. So if you guys are up for it, I want you to do it with me. I'm going to step back just so I don't fall over. So I want you guys to close your eyes, and this will just be a minute or two. If you don't feel comfortable closing your eyes, just gaze downward. And I want you first to calm this limbic system down. So what that means is I want you to focus on your breathing. Maybe take 1 or 2 just big deep breaths in and then out and realize that you don't have to struggle to breathe right now. This breathing is happening whether you like it or not. And the breathing is not something that you need to worry about. And take another deep breath in and out. And then I now want you to focus on the fact that you are sheltered. You are here in this building. You're not out in the cold. It's not raining. You are warm and safe and indoors. And to further that, you are also clothed. You have shelter. You are in an environment where you do not need to worry about where your next meal is coming from. It's coming in 20 minutes or so. And you can calm yourself down knowing that in this moment you are safe, you are going to be fed, you're breathing, your heart is beating, everything is happening as it should. And now what I want you to do is think of one thing that you are grateful for. And it could be something that happened today, as simple as a nice hot cup of coffee on a cold day. Or maybe it was something bigger that happened 20 years ago. But one moment that you are extremely grateful for. And you can feel that sense of gratitude or joy or love, happiness, whatever it brought you. Put yourself immediately back in that moment. So you feel those feelings. You can see what you saw in that moment. And really just try to embrace that feeling as if it's happening again right now. And then when you're ready, I slowly want you to open your eyes. And we'll continue the presentation. But do realize that this sense of calmness and realization that you can control your mind, you can do at any time, and it will help you control your symptoms as well as anything that you're dealing with, because so much of our life is hectic and anxiety and overwhelm and stress. So this is a tool that you can use throughout your days as well. So jumping right on into it, exercise and BDNF. BDNF is the brain-derived neurotropic factor. And the great thing about this is that when you exercise, this is a protein that is released in your brain. And the reason this is important is because it supports the survival of current neurons and synapses that are happening in your brain, as well as encourages new growth. So with multiple sclerosis, you know that some movements are not an issue for you. They might be relatively easy or simple for you to do, whereas other movements are very challenging. So when you exercise for at least 20 minutes, that's it. It doesn't need to be an hour long. Just 20 minutes is all it takes to release this protein in your brain to keep the pathways that are currently working for you working, and to encourage growth of other pathways that might not be working right now. And like I mentioned before, only 20 minutes of this. One complaint I hear a lot from my patients is that I can't exercise for an hour, this isn't going to work for me. Well, research shows that it's just 20 minutes. Not only that, it only needs to be low to moderate intensity level. So you can no longer use the excuse of I don't have time, or I can't give that much time towards exercise, or I can only exercise at a low level, it's not going to do anything for me. Research shows that it will still work for you. Also, the brain-derived neurotrophic factor also helps with cognitive improvement and can help relieve anxiety and depression. So by a show of hands, have you at least heard of the phrase neuroplasticity? Okay. Keep your hands up if you know exactly what it means. Very different questions. So even if you do, we have a couple who stayed up, which is fantastic. But for those of you who don't know, I'm going to explain it for you. Neuroplasticity is the ability that your brain, all of our brains, can create new pathways for a function to occur. And it is influenced by things that you learn on a day-to-day basis. It's influenced by experiences that you have every single day, what you're practicing over and over and over again. Things that you do and things that you don't do. And the way that I like to relate this to multiple sclerosis is, you all can see my arm, right? I'm going to show you this with an arm. This also happens with multiple areas of our body, but for this sake, I'll use my arm. So for neuroplasticity, if I am trying to bend my arm like this, and it's not working, let's just say I'm trying bend my arm, and it's not working, and this is the part of my brain that needs to be lit up and fired in order to have that pathway bend my arm. Well, clearly it didn't just work. It's not working. I'm not bending my elbow. So I try for a second time, and instead of trying to send it this way, when I try on attempt number 2, the brain might do this, bend my arm, and it goes that way. Still didn't work. I try a third time, maybe it goes like this. Fourth time, fifth, trillions of times. Every single time you attempt an exercise, your brain is trying to find a new pathway to make it happen. And it's very frustrating when you're the one trying to bend your elbow and it's not working, because you can't see neuroplasticity happening. You can't hear it happening. You can't feel it happening. So you really do have to trust the process and know that every single repetition you're doing, your brain is trying to figure it out. And this is proven in research. It's not just me saying, hey, do my exercises. Research shows that over time, neuroplasticity will kick in. A more relevant example, I think, instead of bending your elbow, might be lifting your leg. That's another big one that I see a lot in the clinic. It's hard to do that movement. But let's just say eventually, maybe it's on my 2000th try, I try to bend my elbow and it works. Then this pathway that my brain did just fired, it found one that's working. So every time I try to bend my elbow after that, it's going to use that same pathway to work, and it's strengthening that one that has now formed. And let's say right from the get-go you could bend your elbow, you weren't at a point where you can't move it at all, then it's strengthening the pathway that is already there. So whether you're at a point where you're doing an exercise and it's not working at all, or it's just working a little bit but not as good as you'd like, neuroplasticity can help you. Does that make sense? Okay. So physical therapy helps with so many things, and I find that a lot of people think it just helps you get stronger, and that is true, definitely. But it also helps with balance, and there's 2 different types of balance. There's one type of balance where you're just standing in place. There's another type of balance where you're walking and you're moving and you need to not fall over. That's 2 different types, and you need to practice them very differently. In addition to that, aerobic capacity or cardiovascular function, and I just want to make a point about this right now. Research shows in order to get your heart rate up, it only needs to be low to moderate intensity level. Same thing with the BDNF. It does not need to be an hour-long exercise or really intense in order to get your aerobic capacity up. Better yet, it doesn't even need to be with your legs. There are so many exercises that you can do to increase your heart rate and get your cardio system going with your arms in a seated position. So you don't need to tire out your legs in order to get your aerobic system going. There are so many other ways that you can do that, and low to moderate intensity levels. Physical therapy can also help with spasticity and fatigue. Show of hands, who has fatigue? I recently did a poll on social media, and 99% of people said fatigue was their worst symptom. There are 2 different types of fatigue, if you didn't know. Primary fatigue is the first one, meaning there is no reason for it. You did not exercise, you got a wonderful night's sleep, you were not out and about, and you are drained, physically exhausted. It might even be hard to just open your eyes. And then there's a second type of fatigue, which is secondary fatigue, meaning there is a reason for it. You did exercise, you had a late night, you were out and about moving a lot, and you're fatigued for those reasons. Exercise has been shown to help with both types of fatigue, but it can seem very counterintuitive. I hear all the time, how do you want me to exercise today? I am exhausted. And really, it depends on the type of exercise you're doing. If you're coming to me on one of those days, we're doing a very different program than if you're not having a fatigue day. But exercise can help with both types of fatigue. It can also help with depression, walking, brain health, and quality of life. And also, by a show of hands, if one of these areas improved for you, would your quality of life be better? Now imagine if 2 of these were better for you. And physical therapy has been proven to help with all of these. So even if just one is helpful for you, wouldn't your quality of life be a little bit better, a little bit more independent? And I bolded the walking performance because I have so many people who have a goal of walking better, and I love that goal. It is such a fantastic goal. But what a lot of people don't realize is that it's more than just walking. Walking sounds like it's just one thing, like I want to get good at that one thing. Walking, as you can see from this photo, is 60% of walking is time spent on both of your legs. 40%, you're in the swing phase, meaning you're on one leg. So if you don't use an assistive device, you have to be able to balance on one leg for 40% of walking, almost half. So if you can't balance on one leg and you're not using an assistive device, of course your walking's not going to be great. Balance is what you should be working on. But in addition to balance, you also need to be able, I'm wearing kitten heels today, hopefully I don't fall. You need to be able to bend your knee, swoop your toes up, lift your knee up, straighten your knee, put your heel down, and then shift your weight forward and do the exact same thing on the other leg. That's like, I didn't count, I'm pretty sure that's 7 different exercises at least that you need to be able to do if you want your walking to be better. So it's not just walking. We need to figure out what about walking isn't working for you. You need strength, you need balance, you need aerobic endurance in order to improve your walking. Does that make sense? Okay. MRIs also prove that more fit people, and just in general, people who exercise more, who have multiple sclerosis, have less damage and deterioration in their brain after or during a relapse. MRIs also show that you will have an improved recovery after an MS relapse or an exacerbation if you are more fit and you're exercising regularly. And the MRIs also show that you have preserved neuronal integrity, meaning those nerves and pathways that are working, they will stay working if you're more fit and if you exercise regularly, and reduced long-term disability. So this is proven to work. Exercise, we know, for everyone can be beneficial, but specifically with multiple sclerosis, your MS will benefit from it. It's not just physical anymore. So another thing I hear all the time is, but I've tried PT before and it didn't work. Anyone, have you said those words before? Anyone say, yep, a couple of hands risen. So I believe you. I always believe everyone when they tell me that. And there's a couple of reasons that it may not have worked for you before. One being the type of exercises, which I'm going to tell you in a little bit, but another being if you were seeing a regular or a general physical therapist versus an MS specialist physical therapist. And the reason that I know what I put on this slide is because I used to be just a general orthopedic physical therapist. And I'll tell you, I was treating people with MS extremely differently than I do now as an MS specialist, completely differently. So I understand why you wouldn't get better if it wasn't someone who is an MS specialist. Someone who is a general physical therapist will give you orthopedic strengthening exercises. These are exercises such as, do you guys know the straight leg raise? So got a lot of yeses. For those of you who don't, you're lying on your back, one knee is bent, you're lifting your leg up, hold and down. It's a fantastic, one of my favorite orthopedic strengthening exercises for your hip flexors. Technically, your hip flexors also do this. So technically, that should help with walking. But a brain and nerves and spinal cord that has multiple sclerosis does not have that same carryover. So you could have full strength with that straight leg raise exercise and zero strength with this. So orthopedic strengthening exercises will get you strong in that position, but it won't necessarily help towards your goals. Also, a general physical therapist will push you to the point of fatigue, which should never be the case. And it's very non-specific. I could count on multiple hands how many times someone has said, I went to PT, didn't work for me. I asked them what they were doing. They said, I was on the bike for 30 minutes and it didn't help. And I'll say, that will help if your goal is biking. Biking helps with biking. Biking will not help with walking. It won't help with balance. It's non-specific. So An MS specialist will take into account how you're feeling that day. If you come in and you're saying, I'm having that primary fatigue, it is just a bad day for me, and I am feeling awful, I'm still gonna make you exercise, but very differently than if you come to me on a day that you're feeling well. So it's important to take that into account. Also, lots of rest so that you're not working into the point of fatigue, lots of ice water and breaks, so that your body doesn't get fatigued, it doesn't get hot. I didn't put that in this presentation. I could spend 45 minutes talking about heat intolerance. Bless you. Also, asking the right questions. Functional exercise, which is, if your goal is walking, we're gonna break down those things, those 7 different tasks, and practice those 7 exercises, and then work into walking. And it's also extremely important to talk about neuro recovery versus compensation. So neuro recovery would be the hope that your body can recover, that neuroplasticity will happen, that your brain can create new pathways for the movements that are challenging for you to do right now so that it won't be as challenging. Whereas compensation is, we don't think that's going to happen. You've already tried, it's not working. Now we need to come up with ways to compensate. So it's important to have that discussion of where we think you're at. And to be honest, personally, I always assume everyone has neuro recovery happening, especially if you have not done my type of exercises. If you haven't done my type of exercises that are based on neuroplasticity, then who am I to say it's not possible for you to improve from these exercises? So the newest guidelines, this is extremely, well, I think it's extremely exciting. Hopefully you do as well. The newest piece of information, less than a year old, is that if you do aerobic exercise first, and keep in mind, it only needs to be a low to moderate intensity level, 20 minutes or less. If you do that first, before any other type of exercise, it primes your brain for neuroplasticity. So not only is neuroplasticity an amazing thing that happens with exercise, but if you do aerobic exercise first, when I first heard that, I leaped for joy. So functional exercise is the next thing. Your exercises have to be functional. So if you're in my office and you want to work on walking, guess what exercises we're doing? Knee bends, and then hip flexion, ankle dorsiflexion. These are the pieces that you need in order to walk. Once you get stronger at those, we'll practice a single step. And then we practice maybe 2 steps in a row. So you work your way up of practicing the exact tasks. And if it's not walking, maybe it's getting in and out of a car. I literally bring people to their car and we practice, lift your leg up to get it in. If you can't, literally sit in your car seat and practice marching. So the exercises have to be functional. If you have a goal of doing an activity better, the exercise has to be with that activity. You have to have perfect quality. Perfect. Your brain, all of our brains, do not know right from wrong. It doesn't know good quality versus bad quality. It thinks what you're doing more of is correct. So if you are doing bad quality more than good quality, your brain thinks that bad quality is right. And it's going to keep that bad habit over and over and over again. So you have to have perfect quality, high repetitions, meaning lots of rest breaks. A lot of people can only do my exercises for 5 repetitions. And then they have to stop and rest because then it doesn't look like it's good quality anymore. Only do 5, rest. Do 5 more, rest. Do 3 more, rest. 2 more, rest. 1 more, a bunch of times, rest. Overall, you probably did 30 perfectly versus trying to do 10 times 3 sets and you did 30, but half of them were bad quality. Now your brain is just confused. It doesn't know what it's supposed to be doing. And of course, your walking's not going to get better, or your strength with standing up or movement, mobility in general won't be better because your brain doesn't know what it's supposed to be doing. So in addition to those guidelines, it's also important to know how to exercise effectively. So this first one, research shows that if you have distributed exercise, meaning exercises throughout the day, versus massed exercise, which is exercise all at once, it's equal. which I think is fantastic news, because that means if you are too tired to do all of your exercises at one moment, you don't have to do them all at one moment. If you can do some of your exercises in the morning, in the afternoon, in the evening, and maybe at each of those intervals, maybe you're only doing 2 exercises. That has been proven to be just as effective as doing them all at once. So if you feel like you can't do a lot of exercise all at once and you're using that as a reason not to exercise, you no longer can use that excuse. You can do it throughout the day. In addition to that, variable environment versus constant environment. So a prime example of this, I have a patient who comes to me weekly, and her husband came in with her last week and said, Gretchen, Diane can stand up and sit down perfectly when she's here with you, but we get home and she plops down and it's bad quality. And that explains this. Variable environment is better than practicing in a constant environment. She was only practicing in my office. So from that moment on, we practiced in my office. We're not going to go to her home, but we did it in every different treatment room that we had. There's a neurology office across the hall. We went over there and sat in all of their different chairs. I asked their receptionist if we could borrow their chairs. And we practiced sitting down and standing up in a bunch of different environments. And then she was able to do it better at home. Random order is also better than blocked order. Random order, because we're talking about walking, we'll use that example again. Blocked order for walking would mean every time you practice walking, you very first bend your knee, swoop your toes up, knee up, straighten your knee, heel down. Every single time. That's blocked order. Random order would be, all right, today, let's first start practicing with your knee up. And then we're going to practice putting your heel down. And then we'll practice the bending of the knee. It's not in the right order, but research shows that if you're practicing in a random order versus always blocked, it's a more effective exercise. Your brain will learn that movement better. So, I know you guys are eating right now, but you can continue to chew as we do some exercise, right? These are the 2 of my favorite exercises that everyone should be doing if you have multiple sclerosis. So the first one is ankle dorsiflexion or toe lifts. So by a show of hands, does anyone have foot drop or drop foot? Okay, bunch of shy hands going up. So that is one of the most common symptoms in multiple sclerosis. And even if you don't have foot drop, because it's one of the most common symptoms, that is, if you have a relapse or a progression, that is one of the areas that is likely to get targeted next. So you want to make sure that you have super strong ankle muscles, A, to improve the dorsiflexion, to the toe lift, and B, to preserve it if it's already working. So all you do, if you can, get a little bit of space, and you're sitting up nice tall in your chair, and just with one foot, slowly lift your toe as high as you can. And you should feel the front of your ankle squeeze, and then slowly lower it back down. Good, and then up again. Squeeze, 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 and slowly back down. Same thing with your other side. And you may or may not notice that one side is easier or harder than the other. Completely, see a lot of head shaking, yes? Completely normal. Don't give up. Based on that neuroplasticity, it might not be lifting at all. I don't care. Keep practicing. Your brain is, every repetition, your brain is trying to find a pathway to make that happen. So whether it's moving or not, you need to be doing this exercise. If you do this exercise, it will be easier to move your feet around if you need to shimmy yourself in your chair a little bit, or especially when walking, if you don't want your toe to drag, lift the ankle up. Now you have the strength to do that. So that's why this exercise is extremely important for every single person. The next exercise is marching. So, also in your chair right now, if you have a little bit of space, sit up nice and tall, and I want you to bring one knee up towards the ceiling, as high as you can, and then down. And then the opposite knee up, as high as you can, good, and then down. And again, one side might be much harder than the other. Keep going as I'm talking to you. And that's fine, keep practicing. But also remember, perfect quality. If you've got one leg that's flailing out to the side, stop. That leg is done for now. Maybe try it again in 20, 30 seconds. But if it's perfect quality, keep going. Perfect quality, high repetitions, as many as you can. What this exercise helps with is if you're sitting, it helps you readjust your positioning. If you're too far forward, you'll be able to scoot back, or you'll be able to move forward. You need to be able to lift your leg up to get into a car, to get into your bed, to get out of your car, and to get out of bed. This is such a practical exercise that we use whether you realize it or not throughout the day. If you have weakness in this muscle, you realize it. You know exactly those movements that you can't lift your leg. Getting dressed, putting a sock on, lifting your leg up for any reason. In standing, which we're not going to do right now, but at home, maybe try, if you have something to hold on to, standing is this. And then the other side. And this helps with walking, because it's one of the 7 things that you need to be able to do if you want to walk. So this all sounds great, but there are no certified MS specialists who are also PTs near me. Or my insurance only covers X number of visits and I ran out. Or I don't have motivation to keep doing exercises. Or what do I do at home? These are things that I hear daily, or it takes too much effort to leave home. So while I want to be doing exercise and I know I should, I just can't get there. So these are things that I've been hearing for the 5 years that I've been a physical therapist. Around 9 months ago, I started sharing on social media, off and on, the benefits that my patients with MS were seeing, such as one of my patients, after literally just 2 sessions of doing these simple exercises, it's not brain science, but these simple exercises I just taught you, 2 sessions, and he came back and he said that he can now get dressed standing up without falling over. He hadn't done that for years, and he just needed to be reminded of the basics. I also was sharing things where one of my patients, he was using a walker, but he wasn't tripping as much. His ankle wasn't dropping. Or he was able to get into his car better. He fell and he was able to stand up on his own. He didn't have to call for someone to come help him, just from doing these exercises. So I was sharing on social media these positive benefits that my patients were seeing. And around 5 months ago, I decided I can help so many people. You can see on this post, there were 37 comments and 17 shares. So many people on these posts that I was sharing were saying, oh my gosh, I have MS. I wish that you could be my PT, but I'm in Savannah. Or my mom has MS, and she would benefit so much from your services, but she's in Texas. And I was getting these comments day after day after day. So about 5 months ago, I had a beta group version of a virtual support group presentation for multiple sclerosis physical therapy. And around 2 months ago, I think, this article came out from the MS Association of America. I have copies out at my table if you are interested in reading the whole thing. It showed that virtual physical therapy, aka telerehabilitation, is just as effective as physical therapy in person. So I created the Missing Link, which is a virtual physical therapy program specifically for multiple sclerosis. So in the Missing Link program, there are videos of me in my home performing strengthening exercises, stretching, balance, and walking exercises. Each of those categories have exercises that are based on neuroplasticity. It's nothing fancy. It's bringing things down to the basics to do these specific movements that will help with your functional abilities. In addition to that, they are sitting, they're standing. If some are too easy for you, I'm available. I'm an email away to tell you how to modify them to make it harder or easier. And I provide 2 home exercise programs so that if you're like me and you need to know exactly what to do each day, you don't want to just use it a la carte, then I have that for you. I tell you what to do in order to reach your goals. In addition to that, we have task-specific exercises. I just posted one about a month ago on how to get up from the ground. So I'm on my floor in my living room, and I show you exactly what the specific steps are to stand up from the ground and what exercises you can do to strengthen yourself so that you can stand up from the ground. Symptom management, things like heat intolerance, cognitive exercises, fatigue management, energy conservation, all videos of me explaining tips and tricks on how to manage those symptoms. Research updates, Guest speakers, we just had a neurologist 2 days ago, I believe. We've also had a nutritionist. Next month is a neurosculpting meditation. So these different guest speakers that have different types of impacts on multiple sclerosis. We have them monthly. And lastly is the coaching and question and answers. To me, I'm only an email away. When you get started, we also have a 15-minute call so I can help guide you. What are your goals? What should you be starting with? Because as you know, every person with MS is different. You might be diagnosed at the same age, you're the same gender, you have the same type of MS, and your symptoms are vastly different. So I'm able to help you figure out where to start. Before we get into questions for my presentation, I just want to take about 30 seconds to get back into that thing that you were thinking of for your mindfulness. So if you can, finish chewing. I don't want anyone choking. But if you can, close your eyes again and just think about that moment, whatever it was. Maybe it's a new moment, or maybe it's the same one that you thought of approximately 35 minutes ago. And again, put yourself in that moment where you're feeling that much joy or love or gratitude or happiness. And putting yourself in that moment, again, will not only help you retain and recall this information, these exercises that will help you with your mobility later on, but it also will help you get control over your emotions, your symptoms, your feelings, so that you make better decisions and that you have more control over your well-being. So think of that gratitude moment, and when you're ready, open your eyes again. And I'm open for any questions.
Thank you, Gretchen. Does anybody have any questions for Gretchen? I'm going to be running around the room on both sides, so just raise your hand, please. Let me acknowledge that I see you, and then I will be over to you. We'll be doing this for about 20 minutes.
Gretchen, I noticed that you said the first exercise, now I don't remember what it was.
I know what you're talking about.
Okay.
The ankle lifts.
Yes.
Yep.
I go to Abilities Unlimited, and on a night like tonight, I let them know that I'm in late. So I don't need to do the bike first. I need to do the exercises to see if I can do them. And each time I've done that, I've improved tremendously. And then at the end, I go back to the bike. So is that okay?
That's fine. And the bike is different for everyone. It might be tiring you out at first, which maybe is why you couldn't do those exercises. I would still suggest that you find some type of cardio exercise first. And the thing about that research about doing cardio first is that it's so new that we don't know yet how many minutes you need to do it for or how intense it needs to be. So even if it's just 3 or 4 minutes, ask them, if they're trained, they should know, some level of cardio aerobic exercise that does not include your legs. If they have an arm bike, forward, backwards, maybe just weights, up and down, punching. Just moving, just get your heart rate up for at least a couple minutes first. But otherwise, I think that's great. Yeah.
All right. Question number 1. Is there a certain medicine that most of your patients have been on that saw improvement versus other medicines? Did you ask, like, what medicines were they on to see better improvement, or were they just on all different types of MS medicines?
Personally, my clients, all different types.
Okay.
Yep.
And number 2, does your program offer anything as far as back exercises? Like, I know we did a lot about feet, but
yeah,
some of mine is not walking, it's the back posture
Exactly.
straight or whatever. So does your program offer back exercises?
Yes, and I will say, first of all, 80% of people, whether MS or not, 80% of people in life have back pain. However, that's probably, people with MS are about 2 times more likely to have back pain because of weaknesses. So whether you have difficulty walking or not, if you have weakness in your hip flexors, even if you're walking fine, that's going to cause back pain. If you have weak core muscles, back pain. If you have weak ankle muscles, even though it's all the way down at your ankle, if you have weak ankle muscles, everything else up here is working twice as hard So usually your back is overworking. So to answer your question, yes, the exercises in my program will help that. With that said, if you were to talk to me first or email me and say, hey, this is my biggest issue, I can guide you towards those best ones for back pain. Overall, the stronger you are, the less orthopedic pain you'll also be having. Good question.
Question here?
Yep.
If you have problems with tiring after walking for a certain period of time, will the exercises help you to be able to do that for a longer period of time?
Yes. Endurance, I call that muscular endurance, and that is important as well. If you have good strength, but you only have that strength for 5 minutes, then what does that count? You want to be able to have your strength all day long. So part of that is using the theories that we talked about today of as perfect quality as you can, lots of rest breaks, and what you will start to notice over time is instead of only doing 5 repetitions perfectly, now you can do 10 before you need a rest break, or 15 and then you need and then 50 and then you rest break. So your body will start to get used to good quality first, and then you'll notice endurance improving afterward.
On the perfect qualities,
Yes.
since we're doing it with you, not in your office,
Yes.
and we can't see ourselves doing it, how do we know that we're doing that good quality?
Perfect question. I have been doing this long enough in the clinic where most people have the same, not limitations, but the same things going wrong with the exercises. So in my videos, not only do I explain what the exercise is and how to do it, but I also will say, while doing this exercise, make sure your knee isn't falling out to the side. Make sure your toe's not falling. Keep it up. So I point out those things that are most commonly wrong when you are getting fatigued so that you don't do those incorrectly. You're welcome.
I'm interested in your program, but I'm also wondering about insurance aspect and whether I'm going to have to make a claim for the payment or what.
At this point, it's so new. This whole virtual world for physical therapy is brand new. So at this point, insurance does not cover it. So for my program, it's self-pay. Hopefully in the future it will. And even with this article that just came out about 2 months ago, even with that showing that physical therapy virtually is just as effective as physical therapy in person, it's still so brand new that they haven't done enough research on it yet to warrant insurance covering it. So hopefully in the future, but at this time it does not.
Yes, my last bout with the physical therapist, she really stressed the spasticity. Yes,
Yes.
exercises as opposed to the repetition with legs and the foot. How does that fare as far as importance? I mean, she was doing the stretching, and
Yeah.
when I was doing bends, she would like push me a little bit further for stretching the muscles.
Yeah, and everyone is different. If you have more spasticity than weakness, then you should be focusing on spasticity, stretches. So in my program, that's a stretching category. So everyone is different, and that's what I'm hoping to figure out by talking to you one-on-one so that I can guide you towards what you should start with first. With that said, sometimes people have spasticity and they're getting some strength out of that. So if you're so tight that that's what's keeping you upright, then if you stretch too much, I've had before some clients feel like their legs are wobbly or like noodles because they stretched them out and they lost that spasticity, and then they're not as strong. So sometimes some spasticity is good, but obviously a lot of spasticity is not. So yeah, I would say focus on stretches if that's your biggest concern. With MS, you might have weakness and tightness and bad balance and bad walking. So technically you should be doing all 4, but if you're falling a lot because of your balance, prioritize that. If you are tight and that's what's affecting you most, focus on the stretching first. Yeah.
All right, next one's over here.
Yes.
I have a question. With MS, they always focus on the balance in the back and everything. What about your hands?
Ooh.
The numbness and tingling and the use of your hands. Do
Yes.
you do exercises for those?
So my very first guest speaker for the Missing Link program was an occupational therapist, and that's occupational therapy territory. I know a little bit about it because I've worked with occupational therapists before. I'm not a trained professional occupational therapist, but there definitely are strengthening exercises, even stretching exercises that you can do for grip, for finger strength, for buttoning, zipping, fine motor activities like putting earrings in, clasping a necklace. There are exercises that you can do for that. So we had a guest speaker and she gave us probably 7 to 10 different exercises that you can do for that. I will say my best answer for the tingling, numbness, pins, needles in your hands, research has shown that one way to reduce that is to desensitize that area. So let's say it's my right hand. What you could do is get a bowl of rice, put your hand in the rice, move it around. And so your hand is feeling dullness, but also sharpness, because rice is both. And then maybe also get a cotton ball and rub it on your hand. Maybe a pencil, just different textures over and over again, and just you're desensitizing it. What's that? Correct. Put your hand, putting your hand in the rice and just moving your hand around. Maybe you're picking it up, putting it down. Maybe you're just rolling your wrist, but you're just trying to get that texture on your hand. Yep.
Okay, we talked about the exercising and the spasticity exercise.
Yes.
Does doing these exercises help to increase your speed as far as walking? Does it help?
Yeah, I mean, I think indirectly it would, because again, it depends on the reason. And that's why a physical therapist is so important. If walking is limited, we need to figure out why. Is it because you're spastic, so that's reducing your speed? If so, then yes, if we get you more flexible, you won't be held back as much and you'll be able to go a little bit faster. So if it's that and poor balance, or maybe it's that and weakness, target the reasons that you're having those limitations, whether it's walking or a different exercise or different activity or a task, and focus on that. So to answer your question, yes, you would increase your speed.
How does PT help with the heat intolerance?
Like I said before, I love talking about this. I will say the most important thing, show of hands, who gets heat intolerance? This was, when I asked social media, this was another big one that people had issues with. So the most important thing for you to know, hopefully this is the second or third or fourth time you've heard this, heat intolerance is one or many symptoms worsening because your core temperature has risen too much. So if it's a hot day, yes, that can increase your core temperature. But guess what? With exercising, your core temperature also increases. So you need to keep your core temperature down. In the summer, all the time, I have clients come to me and they'll say, Gretchen, I was inside in air conditioning all day long. Even though it was 90 degrees outside, I was in air conditioning and I was so tired. And my legs were just giving way. It was just a bad day. And the reason for that is because air conditioning cools your skin down, but not your core temperature, unfortunately. So you need to cool your core temperature down. Ice water, cooling vests, non-heavyweight ones, ice towels around your neck, peas on your chest, literally just anything you can do to cool your inside core temperature down. You're welcome.
I prefer exercising in a pool because I got a bad back, herniated disc. Any y'all worked up any exercises specifically for in the pool?
I'm just going to briefly run through all my exercises that I have in the program. Most of them you can do in the pool. I'm a huge fan of pool exercises for many reasons. There's buoyancy, so your body doesn't weigh as much. Mostly for MS, the reason I like it, it's easier, so it's easier to have better quality. And your brain doesn't know, oh, this is easier, it doesn't count, I won't be good on land. Your brain just is knowing that you're doing good quality. So if getting in the pool makes your quality better and you can do higher repetitions, go for it. But a lot of my exercises, as long as you can remember them, print out the home exercise program, bring it with you to the pool, do the exercises in the water. Yeah, good question.
Okay, so I'm just curious because physical therapy is like physical things. So is there anything to help with like headaches?
Ooh, headaches so we just had a neurologist on our guest speaker call a couple days ago, and that was a big topic that we talked about. And so just passing along what she informed us, headaches technically are not a direct symptom of multiple sclerosis, but there can be many reasons for it. So her best suggestion was to think of what could be causing them. As a physical therapist, my first thought is posture. I'm really exaggerating, but if you're any variation of slouching, then if you're like this, that's tightening all of these neck muscles, and that can cause headaches. So if you can strengthen here and here, that can likely reduce headaches. So maybe it's postural, maybe it's medications, maybe it's a mix of medications, maybe it's you're dehydrated, you're not drinking enough water, especially if there's urinary issues, urgency, frequency, incontinence. So maybe dehydration, maybe not eating the right types of foods. So that was her suggestion, is trying to figure out if any of those categories could be it. If so, talk to either your PCP or your neurologist about that.
I have another pool question for you. Going back to physical therapy, doing it in the pool, and the problem with heat intolerance. So do you have a parameter for the temperature?
86 degrees or
86.
less. 86 is what it says in research. I would say 84 or less, but technically it's 86 degrees or less. Yep.
Or less. Yeah.
Or less, yep. Yeah. It should not be over 86.
Any other questions? It's hard going back and forth. It's good exercise, though.
Right?
Right?
March as you're doing it.
I wish I could. All right, any other questions? If not, let's thank Gretchen for being here today.
All right, thank you guys so much.